Bi-State Primary Care Association helps New Hampshire Community Health Centers expand healthcare services to more residents, especially to those with limited access to healthcare.
The doors are open at community health centers, and no one is turned away because they are unable to pay. You might wonder how we do it.
New Hampshire's network of community health centers are on a mission to provide high-quality preventive and primary care in their communities.
I'm Tess Kinning.
I'm Rick Silverberg.
I'm Vanessa Santarelli. Those stories and Randy Mooney today on 16 Minutes.
Bi-State Primary Care Association helps New Hampshire Community Health Centers expand healthcare services to more residents, especially to those with limited access to healthcare. In New Hampshire, those with limited access include working families with low-paying jobs that don't offer insurance, self-employed people who are unable to afford insurance premiums, or our neighbors who have lost their jobs and their health insurance. In some cases, limited access is due to the fact that there aren't enough healthcare providers in the region where they live. Part of the solution to limited access of primary care is community health centers and their patient-centered medical home model of care. The medical home, also known as the health home, provides a single source of access to patients for medical, dental, and behavioral health care. It's the first and only call a patient has to make.
I've been a patient with Families First for about 4 years. I started coming here for primary care for myself, and it has developed into I came here for prenatal care, I come here for pediatric care for Stella, and I come here for dental care for myself as well.
Where did you go for medical care before you came to Families First?
I didn't. If it was really necessary, I would go to the emergency room in the town that I lived in for care, but otherwise I would go without. I don't know where I would go if not for Families First for both of us.
We are able to serve a really diverse population. We serve the underinsured, the uninsured, the privately insured. My name is Marissa Rolson. I am a certified nurse midwife and a nurse practitioner at the Nashua Area Health Center, which is a center of Lamprey Healthcare.
I really enjoy the opportunity to take care of patients where the financial barrier to care that we see so much of in our country, unfortunately, we're able to break that barrier down. So I end up seeing a very broad array of patients from various socioeconomic backgrounds. I may see someone who's the CEO of a large company, very successful, where there's basically no financial barrier to care. And then the next patient I go into the room is someone who's, of unfortunate circumstance, facing a major financial barrier. And our program, helps that person have access to primary care in terms of seeing me, but also labs, tests, studies that may need to be done at the hospital. My name is Dr. David Nelson. I'm a family practice physician with Ammonoosuc Community Health Services.
By connecting people to an integrated system of care from a single point of entry, the cost of providing care across the spectrum is greatly reduced for the entire healthcare delivery system. Not only are health homes more cost-effective and efficient, they also have the potential to achieve healthier outcomes for patients. For example, when a doctor at a community health center encounters a patient in need of dental or mental health services, they can provide direct access to an appropriate clinician for that patient. Right now, in some of our community health centers, the patient just has to walk down the hall to see the dentist or the clinical social worker. The cost savings and healthier outcomes inherent in the health home model are being realized here in New Hampshire every day.
I love that we have a mix of professionals, pediatricians, nurse practitioners, physicians, and they were all pretty much the same, mission-driven, here to take care of the patient and the community, try to do the best quality care that we can. I'm Sally Oxnard, MD. I'm a pediatrician at Lamprey Healthcare and the medical director.
We also talk about meaningful use of data. Community health centers collect data through electronic health records. Using the data collected, a health snapshot of a community can be charted and used to understand any widespread health issue facing a local community. Is diabetes or asthma a particular problem? If so, the community health center can provide not only the medical care services to support the patient, but also programs to help community members prevent or manage their diabetes or asthma. Is it flu season? In Berlin last year, the community health center used their electronic data to contact all their high-risk patients during flu season and coordinated with the local health department to quickly vaccinate people over the course of just a few days. To be sure, healthy communities are less taxing on the support systems provided by state and federal government. Our nonprofit community health centers are dedicated to providing a smart approach to health care to support healthy children ready to learn and thriving healthy workforce. Thank you for your support.
Last year, New Hampshire's community health centers provided primary care to more than 110,000 people. Nearly a third of their patients were uninsured. Many had lost their jobs and were unable to pay for services. But the doors are open at community health centers, and no one is turned away because they are unable to pay. You might wonder how we do it. After all, the cost of providing medical, dental, and behavioral health care is significant. Many organizations, including the state of New Hampshire, play a role in maintaining an integrated network that supports the delivery of healthcare services in this state. Educating the clinical workforce, recruiting doctors, nurses, dentists, and other clinical staff, and managing health centers in a very cost-efficient manner are all important components of the system. Multiple partnerships amongst numerous organizations and funding streams are essential. You might also wonder why we do it. As the director of one of New Hampshire's community health centers, I can tell you it's because we care about you, your family, your neighbors, and your community.
We have clinics running every day of the week, and we are open to any person who might be homeless at any age. We run our clinic without appointments. People can just kind of come on over and sign up, and we try to see them that day or triage them if there's an urgent need, if we cannot see them, or see them the very next day. Yes?
Another way is through the emergency department at local hospitals. We often will get a call saying that they have referred a client to us who needs continuing medical care.
We're really great partners also with the addiction treatment programs here in town, and so we help people who need addiction treatment, residential treatment, long-term counseling. They always need a medical exam prior to their entry, so we provide that to lots of people who would have no way of getting into treatment without it.
We have a wonderful collaboration in this area with Mid-State Community Health Center, and that collaboration goes in a number of directions. We work on behalf of health and wellness community-wide in a number of ways. For example, we're all part of putting together an accountable care organization, trying to integrate systems, trying to provide cost efficiencies for everyone in this region, and trying to incorporate the kinds of things we're doing on campus with community programming in health and active living into what the healthcare providers know and are able to use. I'm Sarah Jane Steen, and it's my honor to serve as the president of Plymouth State University.
We have the data to prove community health centers have a positive impact on the economy in New Hampshire. We also have our day-to-day experience in communities throughout the state that tell us we are making an invaluable contribution to the well-being of our friends and neighbors. Building a healthy community is the most rewarding job I could have.
The question has been raised, and rightly so. Did New Hampshire benefit from the stimulus funding in the American Recovery and Reinvestment Act? In terms of creating opportunities and growth in the primary healthcare sector, the answer is yes. New Hampshire's network of community health centers are on a mission to provide high-quality preventive and primary care in their communities. Commercial insurance, Medicaid, and Medicare are accepted at community health centers, and a sliding fee scale based upon income is available to the uninsured. For more than a decade, the health centers have struggled to obtain capital loans to renovate their deteriorating medical offices, expand their facilities to serve more patients, and purchase new medical equipment. By 2009, their capital needs had grown to $22 million. Already serving tens of thousands of residents, with more coming in every day, the community health centers reached or exceeded their physical capacity. They needed to expand their physical space and workforce to meet the increased demand. The problem grew so severe at one health center in Dover that broom closets had to be turned into physician offices so more patients could be seen.
So we've expanded our services as the needs in the community have expanded. So in 2004, we added 2 operatories here at the Dover site. We ended up combining a closet and a bathroom to make space for a provider where she actually does interviewing of patients. So you can see that not only will the new building bring a more respectful place for staff, but also for our patients. In fact, in 2009, we added 1,000 individuals, and we really don't have enough space to add another provider to care for the individuals.
Just when the community health centers began to think that they would never be able to expand to serve the growing needs of their communities, Congress passed the American Recovery and Reinvestment Act, which provided the necessary funding to purchase medical equipment, hire construction companies to build or renovate new facilities, and hire additional health care providers to serve more New Hampshire residents.
My name is Ed Shanshala, and I'm the CEO of Amanuset Community Health Services in Littleton, New Hampshire. Amanuset Community Health Services started in 1975, became a federally qualified health center in 94, and implemented an electronic health record on the leading edge in 1996. At this point last year, we provided care. Over 8,000 patients came to see us. We provided over 30,000 encounters. And the area that we serve is 26 towns, and those 26 towns have about 30,000 residents. And of those 30,000 residents, roughly 1 in 3 of friends, family, and neighbors consider us their patient-centered medical home of choice.
How many subcontractors are we using on this job?
We're using like a dozen, 14.
How many directly here from Littleton?
4 or 5.
4 or 5?
Yeah.
That's pretty good. Yeah. What you'll see is we're going from 7 exam rooms to 12. We're going to go from 1 procedure room to 2. In addition, we're also going to have 2 consultation rooms, which will be geared towards our behavioral health patients. What we have here at an FQHC is a model where behavioral health is tightly integrated with our health care. So if a patient comes in and they're in crisis, the physician, the doctor, can grab the behavioral health specialist, bring them into the room with the patient while they're in crisis to immediately deal with and start providing intervention for the behavioral health challenges.
I'm Ann Peters, and I'm the CEO of Lamprey Healthcare. Our contractor is local New Hampshire, and he'll be starting soon. So there'll be those local construction jobs, but in addition, it's allowing us to keep all of our 45 plus employees down there. And then in the new place, we will have space to add additional providers to meet the need that is already coming to our doors, but we need to have the space to add the provider capacity to meet that growing need.
New Hampshire's community health centers are using the federal stimulus funding for the purpose that was intended. If you only look at the 3 health centers who received the facility improvement project funds and the stimulus, they anticipate hiring approximately 14 new medical personnel, over 60 new construction-related jobs, and they will be able to care for more than 8,300 new patients. With locations conveniently located throughout New Hampshire, the health centers collectively employ over 1,000 workers with an annual statewide economic impact in excess of $77 million. It's a prescription for a healthy economy and a healthy population.
Do you ever wonder why we have a shortage of primary care doctors? Well, I certainly do. Medical school is very expensive, and the majority of graduates leave medical school owing more than $100,000. I wonder, do you really want your doctor preoccupied about their debt while they're holding a needle in their hand, preparing to give you a shot? I know I surely don't, but then again, I'd rather not have any shots at all. One reason for the decline of doctors choosing to go into primary care is they can earn more money in specialty medicine. A higher salary means they'll be able to pay their debt off a lot sooner. It's a sensible personal economic decision. I don't hold it against them. Fortunately, the wise people in the great state of New Hampshire have a program for addressing this problem. They call it the State Loan Repayment Program. This program provides an incentive to primary care doctors to choose New Hampshire Community Health Centers as a place to practice. In exchange for their commitment, doctors and other qualified providers are eligible for assistance in repaying their medical school loans. New Hampshire is a business-friendly state, which probably factored into the decision to create this program. I mean, I can just picture trying to promote business investment and expansion in towns where there are no primary health care providers for employees or their families. Don't think so. New Hampshire has always been on the right track when it comes to investing in the loan repayment program. I have no doubt that they will compete successfully for primary care providers in the years ahead. Now, if you'll excuse me, I have some packing to do. I'm moving to New Hampshire. I'll have ready access to my primary care doctor there, and the White Mountains are pretty nice to look at too.